Hello, Rancho Cordova residents and businesses. I'm Rancho Cordova City Council member David Sander, and I'm also a virologist, a scientist who specializes in the study of viruses. Sacramento County Public Health, healthcare networks, and pharmacies are continuing to vaccinate people to safely protect them from COVID-19, beginning with those with the highest risk. Now, many of us have questions about COVID-19 vaccines, but it's difficult to know what information is factual. So we're creating a 4-part video series to help answer your questions. In part 1, you'll learn the basics about COVID-19 vaccines. Let's get started. COVID-19 vaccines have gone through rigorous studies to ensure that they are as safe as possible. The U.S. Food and Drug Administration, or the FDA, has granted emergency use authorizations to 2 COVID-19 vaccines that have been shown to meet rigorous safety criteria and to be effective based on data from very large clinical trials. The Centers for Disease Control, or CDC, has systems in place to watch for safety issues across our country. And remember, these vaccines are being administered not just in the United States, but all over the world. Some have worried that vaccines were produced too fast. The reason they were quickly made is that our vaccine making technology is better than it's ever been before. And more importantly, the federal government invested billions of dollars to get the safety testing done on a large scale. So it's the size of that financial investment that made them come to us quickly. No safety corners were cut in creating these vaccines. Quite the opposite, actually. These are the best vaccines ever produced against a virus. First, COVID-19 vaccination will help keep you from getting COVID-19. COVID-19 vaccines are highly effective at preventing COVID-19 and may help you from getting seriously ill even if you do get it. And it may also protect people around you. Secondly, COVID-19 vaccination is a safer way to help build protection. COVID-19 can have serious life-threatening complications, and there is no way to know how it will affect you. Plus, if you get sick, you could also spread the disease to friends, family, and others around you. Third, COVID-19 vaccination is an important tool to help stop the pandemic. The combination of preventative measures such as wearing masks and social distancing and the vaccine offer the best protection to keep you safe from COVID-19 and stop it from spreading. The COVID-19 vaccines require 2 shots to get the most protection. Pfizer doses should be given 3 weeks apart, or 21 days, and Moderna doses should be given 1 month apart, or 28 days. When you get your second shot, get it as close to that timing as possible. You can still get your second shot after those times if, for example, a second dose is not available yet. No, the vaccine is being provided at no cost. Vaccination providers can charge an administration fee for giving the vaccine, which should be covered by insurance or Health Resources and Service Administration's Provider Relief Fund. In addition to issuing emergency use authorizations for the 2 COVID-19 vaccines, the FDA is working with other vaccine developers, researchers, and manufacturers to help expedite the development and availability of medical products to prevent and treat COVID-19, including more vaccines. For example, Johnson & Johnson is currently in the development stage of a single-dose COVID-19 vaccines. Do you have more questions about vaccines? Type them in the comment section down there below. Visit the city's coronavirus webpage for even more information about COVID-19 vaccines, or call City Hall if you don't have access to a computer. We can help you slow the surge, Rancho Cordova, but only if we do it together.